community hospital which began in 2008. The idea of the hospital was to uplift the livelihoods of the locals in this area. This is Sonak Community Medical Center. It is a hospital that was born with a mission to provide a quality, holistic, integrated healthcare services that is equitable and accessible to humanity, exemplifying the healing ministry of Christ.
I am Solomon Akali. I'm the CEO for this facility known as Sonak Community Medical Center.
Solomon Akali, famously known as Omroka, is the brain behind the inception of this community hospital. The hospital's chief executive officer, and he says it has been a tough journey for the project to have a current phase.
Sonak, I came about that name, one, because I wanted to associate myself with the community. So Sonak, in a nutshell, stands for my name, which is Solomon Akali, in short. And there's the community medical center aspect of it, because I am serving the community of this region. So I said, let it have my bearing as a service provider within this community of Khwisero, sub-county, and even the environs. So I started having a thought about establishing this facility in the year earlier, before 2008. I started trying to think how I can assist my people. But when I came around, I found there's a lot of need for health services. By that time, we had a few facilities around which were credible. And so in the year 2018, that's 2018, I decided to come up with this Sonak Community Medical Center. I applied for registration with the Kenya Medical Practitioners and Dentist Board, and it was licensed in the same year. And now I decided, now let me come on board and then try to give services to the people, to my community who are in need. And as such, we started our business to take care of the community. It's also giving back to the community, because the one which brought me up. We had quite a number of challenges, because one, what we call the adaptation. Because initially I used to practice away from my home from the time I trained as a medic up the time I started establishing this business. So many people did not know who I was. And as such, when I began, I did not have the right clientele. And of course, we had some challenges in terms of maybe my rivals who are around. Maybe there's some who felt challenged that some new blood had come in the region, and maybe I will carry away their clients. So I think there was also politics, but maybe from the people we call the rivaling facilities within the region. And of course, as you begin, you don't have already an established clientele. So you're beginning from scratch. And so the capital was also an issue, because we came from a humble background. So I had to really struggle to come up with the capital to put up this facility, because when you begin it as a small facility, the demand about the equipment, the demand about the medicinal drugs, the demand about the supplies, all this come with a cost. There's the demand about the staffing, and all those are challenging, because you may not I do not have an established platform of monetary payments to give these staffs. So I had to go slow just to manage the convenience.
His vision is to make Sonak Hospital, which is currently level 3 hospital, progress to a level 4 status and be a center of excellence and ensure efficient, integrated, equitable, affordable and accessible holistic healthcare services to the community.
The Sonak Community Medical Center, we have various services we offer. Of course, we have the outpatient services. In the outpatient services, we handle most of the conditions within the community. Those are the conditions should be both preventive and both preventive medicine and even the ones for those ones who need to be admitted. So in the outpatient facility, we treat all kinds of illness, including the infections, malaria, life conditions like hypertension, diabetes, and numerous, all kinds of infections, which are handled in the outpatient. In the outpatient aspect of it, we also have special clinics where we have clinic for people who are suffering from tuberculosis. We have services in the outpatient for those ones who have HIV infections. We have in the outpatient the family planning, both for the mothers who are expectant and their children. That's the maternal child health clinic.
The hospital is currently offering services to more than 200,000 people from the sub-counties of Khwisero, some parts of Butere, some parts of Emuhaya, some parts of Lurambi, and some parts of Ikolomani sub-counties. The reception is manned by professional staffs whose major role is to assist patients, provide help and answer their queries. They are the first persons with whom patients contact upon entering the hospital.
I'm William Katakoting. I come from Marama in the area of Emarenyo, Butere sub-county. And why I chose the facility of Sonak Medical Center, Community Medical Center, it was the important and the essential and the duties performed in that community center, whereby I chose all my siblings, among other siblings that come from the extension center of Khwisero sub-county, Kakamega County. One of the important that is that I chose Sonak Medical Center. It healed up. Actually, they treated and healed up my biological mother, who was suffering from diabetic problem. She had pressure. When I visited the Sonak Medical Center, there are essentials, the doctors who are assigned duties by director by the name Solomon Umroka. And the nurses, they really appreciated, I'm very appreciative to their work. They welcomed me with my patient, my biological mother. They worked on her. After just some 2 days, she had picked up the memory. She had picked up to the moment we are talking. She's doing very well, planting her own sukuma, planting her tisaka.
An effective laboratory service is an essential part of the functional health service. The malaria disease for a very long time has been progressive hindrance to the people within and outside Khwisero. The availability of stable and effective laboratory at Sonak Community Medical Center has helped in diagnostic procedures.
Yeah, my name's Kevin Andende Odongo. I work here at Sonak Community Medical Center as a laboratory technologist. I take part in diagnostic procedures whereby after the client has been introduced to the clinician, he's then sent into the lab to do some diagnostic for various diseases. For example, diseases like malaria and many other serological tests. The most common test we are doing here is a blood slide for malaria, since this is a malaria zone, malaria pandemic zone. And also we do some other tests like typhoid There is also brucella. There is rheumatoid arthritis, that is rheumatoid factor. We also do serological tests like VDRL and also HIV and many others. There are so many. Again, when it comes to blood grouping, we also perform it, and we also do cross-match for blood.
At Sonak, the laboratory is staffed with experienced technologists and phlebotomists. Routine tests results are available within 1 hour of sampling or receiving samples. With a bed capacity of 50, Sonak Community Medical Center is capable of accommodating all types of patients. The general ward has beds with lockers. The pharmacy department is involved to provide pharmaceutical care to achieve the treatment goal individualized to each patient.
I'm Daniel Musukuni. I'm a pharmacist at Sonak Community Center, and I'm the pharmacy in charge. In pharmacy department, we do several duties. One and main duty is drug dispensing. Under drug dispensing, there is a procedure on which we pass on. Under drug dispensing, we also do what is called procurement of drugs at the facility. Drug dispensing involves several steps. One, you have to come in contact with a prescription first, and then the prescription should be valid, bearing the name of the patient and the signature of the prescriber. Then second, you also look at the date of prescription, if it's dated or not dated. Then we move to another step. We look at the name of the drug prescribed. You have also to note that there are several drugs with different brand names. You have to be familiar with the brand names of drugs. Another thing, we look at drug interactions and contraindications. Whether a drug interacts with another one, there is a way we solve with the other department, with clinicians. And then another step, we look at the expiration of drugs. Before you dispense any drug, you have to ensure that the drug is valid and is not attaining the date of expiry. Then lastly, you have to calculate the dosages required based on the body weight, and then you dispense all those medications in a conversant language that is well understood by the client or the patient.
The pharmacy team dispenses branded medicines and quality generics.
We understand that drugs are regulated, so you need to be aware that dispensing over-the-counter drugs, and also we have drugs that are controlled. They are called dangerous drugs. They should be dispensed using a valid prescription, or otherwise, if you come into contact or a misconduct with such cases, you may be liable to even being sued in the courts.
The pharmacy is opened 24 hours. Most of the professionals working in Khwisero prefer to be treated at Sonak Community Medical Center because of the high professional standards.
I'm Jane Bwenda Kuboka. I come from Evinda area. I'm a secretary by profession, working with the ACK St. John's Khwisero Secondary School, a school which is just a few meters from Khwisero town. That is my facility. It is my facility for I myself, my family, and even the friends I meet. I normally recommend them for Sonak because their services are good, they are most welcoming, they they attend to patients in a good manner, and they don't waste time when a patient arrives. So I like Sonak, and I've been using the facility for so long. And in fact, I thank God for giving us this facility, because me as a person, it really helped me, because I was traveling so far places to look for medication. Like sometimes back then, my child was sickling. I used to travel up to Mukumu Hospital where I could get the services. But since Sonak came, I really appreciate, and it has really eased my time, because even outpatient, I can access the services, and when it becomes worse, you go for admission and you receive the best of what you expect from the facility.
My name is Amos Oyoko. I come from this area, Khwisero Sub-County, Kakamega County, Western Region. I am a constant client of Khwisero Sonak Medical Center, where I regularly receive medical checkups. I want to say that I'm impressed by the health institution. I've constantly, for the last 10 or so years, regularly received my treatment from that particular facility. The facility has, the management has put in place or has employed enough personnel, both from the nursing section and the medical officers. Wherever you reach the hospital, wherever you reach the facility, you are attended to right in time by the qualified medical personnel, which makes it a preferred medical facility within this particular region. We equally have ambulances, enough, not just one, around 3 or 4, which are helpful in case there are emergency cases for referral to either Kakamega General Hospital or Butere or any other private facility around here when referral cases arise.
Sonak Community Medical Center is accredited by the National Hospital Insurance Fund to offer outpatient and inpatient services to its clients. The Chief Executive Officer says that the accreditation was also a blessing to his clients.
So the NHIF packages came like gold, because as you know, our community is having poor cash flow. We don't have a cash crop in our community, and so most of our people are poor. They don't afford much on the table. So when it comes to meeting cash for treatment, it was quite a challenge. And now when NHIF came in, we embraced it so well, and our community has really embraced it. In fact, it has taken us quite a big step, because from where we were level 1, we have reached this level 3B currently because of NHIF. Because now, most of our people who are now accredited on NHIF cards are able to take care of their medicinal problems. When they are sick, they come around. We give them both outpatient treatments, inpatient treatments. And now we are able to move, because you can actually budget. Because initially you could do budget from scratch, and since the cash flow is down, you could be unable to balance in terms of salaries and the medicines. But now with NHIF, you are able to, you can actually budget, despite the fact that occasionally we have some delays in their payments. But it's a sure bet, you are sure that at a given time you'll be paid. In the outpatient also, we have services like the dental clinic. We have a dental clinic which is accredited by NHIF, and we cover all the acceptable dental services within our description. Of course, we have counseling services. We do counsel people coming with the various aspects of maybe queries or conditions. So we offer counseling services. Of course, in the outpatient, we also have the EduAfya program. We take care of the students who come from within the schools around, who come for medical care. So we also have a network of facilities in terms of the EduAfya program.
And in fact, furthermore, when my principal came, because I said I'm a secretary, I recommended the hospital, the facility for the school, and all our students, they get services from the facility. And we are very grateful and really appreciate. Even the doctors there, those who serve, they serve diligently to the community.
Because of the NHIF card, I can easily access both my inpatient and outpatient medical services for myself and my immediate family. The health facility runs for 24 hours, so on 24/7 hour basis. Anytime I visit the hospital, or anytime any dependent of mine visits the host facility, they get adequate treatment or adequate health care.
Eventually, when the National Hospital Insurance Fund requested me to actually decide which facility I can take my siblings, I decided to take my siblings to Sonak Community Medical Center. And that is a center that has really employed nurses who are able, doctors who are able, under the management, all the departments very active.
The facility offers ultrasound imaging, including pregnancy ultrasound, diagnostic ultrasound, and ultrasound guidance for procedures.
We have ultrasound, which we use for the antenatal mothers and even for the other patients. But the same ultrasound, we also use it for our inpatient clients. We have the inpatient unit where we have the pediatric ward, where we admit all children in the pediatric bracket, all the ages from 0 to 15 years. That's 0 to 13 years. Then we have the female ward, which we have 2 wards for the female ward. The females are usually more sick. We have the male ward, also 2 wards for the males. Then we have the maternity wing, where we have the mothers who come in to do delivery for the offsprings. We do the delivery services, and as well as family planning services in the maternity. Then we do a follow-up in the outpatient part of it.
I'm an outpatient client who is treated from Sonak Medical Center back home. I'm an inpatient client. Both the extension of the neighbors from my area, I come from Butere, they are all, they know the work done in Sonak Community Medical Center is apprehensive, and they do an exemplary comparatively to any other centers. I want to agree with the national government of Kenya. If they can apprehend and upgrade Sonak Community Medical Center to a level that actually grades them to a level 4 hospital, or any other reference is done from Sonak Medical Center, is not doubted.
Sonak Community Medical Center is organized to provide services for both well and sick children from ages of 0 month to 14 years old, and for postpartum mothers. This provides essential antenatal and postnatal care, nutrition and health education, and ensure safe delivery through trained birth attendant.
I want to thank the manager or the proprietor of this particular institution for the kind of effort he has put in place to us as a community, Khwisero community, because it stretches Khwisero neighbors Emoaya, Khwisero neighbors Butere, Khwisero neighbors Shinyalu, Khwisero neighbors Lurambi, Khwisero neighbors Game. Sonak Medical Facility is a place to be in terms of medical attention.
The community, through their administrator, Enoch Kataka, say Sonak has been a blessing.
Sonak Medical Center is one of the community-based medical facilities we are having around Khwisero Market, and it's one of the facilities that are serving the community well. One, it has been in the community for the last 15 years. It has been giving patients the required service, treating malaria, children care, delivery, and many other services, including immunization plus circumcision. First, let me acknowledge the facility for giving services to locals. It reduced the expenses where our community members used to use a lot of money on transport to carry their patients to go away, like Kakamega, Mumias, Yala, seeking for medical services. But simply because now in the community, it has reduced that part of expenses. Two, the medical facility has really employed locals and other professionals from within the county and outside the county who are working in the facility.
In order to offer inpatient services to clients, the hospital is equipped with facilities to assist the patients, as well as having a laundry department with professionals to maintain hygiene standards. The kitchen department staffs, who are highly trained to offer catering services, ensure that patients receive meals according to their specified diet. A mortuary is an integral part of every hospital as it deals with the preservation of dead body. Sonak Community Medical Center offers mortuary services for local clients, although it was not an idea easily welcomed during its inception.
There's sometimes we could feel maybe you could receive a patient or a patient in his last state, or some people could bring you a person thinking that he was alive, and then kumbe this person is already dead. On examination you find he's dead on arrival. So it could bring a lot of eyebrows around, because now relatives have brought somebody, or a well-wisher has brought somebody to the facility, but on examination you discover this person is not breathing. So once you declare this person dead on arrival, there was to be panicky around the place, because now other patients are also wondering what's happening in their environs. Some clients could be brought by even the police. They say, just certify for us, maybe road traffic accidents. Then you discover this person is actually not breathing. So, and also the catchment, the mortuary services around, it was quite a distance. So I felt that let me have some small morgue to serve my community. And the first perception for the community, especially for the political world, they felt a bit infringed. They were saying that I think a mortuary is not supposed to be in the community. But we brought some serious thought in their minds, and we proved to them that other places, you go to other towns like Kisumu, Nairobi, you'll get a mortuary service just next to the hospital, and even not far away from an estate, so long as the embalments are done well.
Sonak Community Center has a morgue service, and it's the only morgue we are having within Khwisero sub-county at large, where our people used to suffer, our people used to go very far seeking for mortuary services, but for now, almost everybody is getting services from the Sonak Medical Center. It's even going beyond the sub-county. It's serving Butere, Lurambi, and Idaho people.
You are directed exactly to go where you are supposed to. If you are supposed to go to go and see the doctor, the reception directs you to the doctor. From the doctor, go to the laboratory. From the laboratory, you are told to wait for some time for the results to come out. And the diagnosis done in the laboratory is 100%. It's the same way diagnosis done in Kakamega General Hospital. It is the same way Sonak Facility Community Medical Center does. when the Sonak Community Medical Center refers, that reference is adhered to the level of the hospital they are referring the patient. So Sonak Medical Center, I want to believe it does exemplary job, of which I want to believe and say the national government should look at it by bringing the facility under the management and director by the name Solomon Omoroka Akali.
In terms of investments, we want to thank the director of Sonak for having put there that facility. Simply because, one, it has employed people directly and indirectly. We have the borders who are benefiting from that place by carrying the patients to and from the facilities. We have the mamambogas who are supplying the hospital with the boga, matunda, and the likes. The shops around are also doing the same, are in business with the Sonak. So we are encouraging other investors to come around and do business in Khwisero so that we uplift the economy of Khwisero people.
My message to the community, always whenever they come, we always say that I've always told the community that we are here for them. And we are here to give a service for them. We do not come here for commercial purposes. And because when most of them come, and some of them are unable to meet the treatment costs, but you still give them the treatment with full dosages, they get impressed, so they keep on coming and coming. So my message to all of them is that I came here for a service, we are here for them, we do not come here for commercial purposes. So long as we get some small soap for continuity, they should embrace this facility so that it can go to greater heights and that the community will not lack. The community will not now look forward to traveling to further distances, like going all the way to our referral centers in Kakamega or Kisumu, looking for the services that we shall be able to provide. Because once we get to a level 4, then I think we may be able to have all the specialized services that we intend to have within this region. And I think the community will, since it's now already embracing, because our clientele has gone beyond where we expected, I believe that we shall go places.
They treat and God heals.
Indeed, this is the journey of Sonak Community Medical Center.